This is Dr. Grande. Today's question asks if I can analyze the mental health and personality factors that may be at work with the fictional character Hannibal Lecter. Other questions here include, is Hannibal Lecter a psychopath? Is his character realistic? And is it congruent with what we know about serial killers? Just a reminder, I'm not diagnosing anybody in this video, only speculating about what could be happening in a situation like this. If you enjoy this content, please like this video, subscribe to my channel, and consider supporting me on Patreon. I'll put the link to Patreon in the description for this video. So Hannibal Lecter is a fictional supervillain, serial killer, created by author Thomas Harris. Lecter has been featured in 4 books, 5 movies, and a TV series. The books would include Red Dragon, 1981, The Silence of the Lambs, 1988, Hannibal in 1999, and Hannibal Rising in 2006. For the movies, we have Manhunter, 1986, The Silence of the Lambs, 1991, Hannibal in 2001, Red Dragon in 2002, and Hannibal Rising in 2005. And for the TV series, we see it's just named Hannibal, and it ran from 2013 to 2015. So I'll issue a spoiler alert for all of those media products. The American Film Institute selected the Hannibal Lecter character from the movie The Silence of the Lambs as the #1 villain of all time, putting him ahead of Darth Vader, which doesn't make a lot of sense to me, but that's a whole different topic. So why do people like Hannibal Lecter so much? There have actually been a number of items that have been brought up to answer this question. Here are a few of them. He's portrayed as extremely intelligent. He gets all of the best lines in the books and movies. He's the star of the show, so to speak, so this makes sense. He makes his adversaries look foolish. He's extremely calm and collected. He builds on the fascination that people already have with serial killers. He's able to sidestep a lot of the flaws that would discourage somebody from liking a serial killer, which is actually pretty interesting considering he does retain the central flaw, the killing people part, but I guess his charm somehow makes up for that, for a lot of people at least. He's civil and polite, which again seems to make up for a lot of his shortcomings. It's like people are saying, I don't like all the killing, but I'm glad you can be polite about it. To many, he is the perfect anti-hero, the quintessential organized serial killer. Hannibal Lecter is so popular that some investigators have misinterpreted evidence surrounding murder cases that may appear to be tied to serial killing because they assumed the killer would follow the pattern of Lecter. Put another way, he's a bad influence on investigators. Now, this reminds me of Don Johnson's character, James Crockett, from Miami Vice. He was featured in that show as holding a handgun up alongside his face, pointing the gun in the air, like before he would enter a room or something like that. It's a very bad habit. It's not a good way to handle a firearm, yet we know many police officers were profoundly influenced by the way James Crockett held a weapon. So again, sometimes fictional characters aren't the best source of learning for professional practice. According to Hannibal Lecter's creator, again, Thomas Harris, the inspiration for the character came from a trip he took to Mexico when he was 23. He was a reporter at that time, and he interviewed a physician who had been convicted of murder. Many people have noted that Hannibal Lecter is actually quite unrealistic as a serial killer, and the thinking behind this is that Harris was heavily influenced by a popular dichotomous classification of serial killers, specifically organized versus disorganized. So this may be one of the problems behind this particular character, the influence we see on the author from this paradigm. What's so interesting about this is that Lecter is shown as criticizing this specific model in the 1988 book Silence of the Lambs, yet the character meets many of the 14 characteristics of an organized serial killer. So I will begin my analysis of Hannibal Lecter with this idea. I'll go through the 14 features of an organized type serial killer and show how Lecter compares with each one. Starting with number 1, an organized type killer has above average intelligence. Lecter's intellect is described as not measurable by any means known to man. That seems to qualify as above average. So really he has a nearly impossible IQ. Again, he's a supervillain. Item number 2, social competency. Lecter was quite prominent in desirable social circles. he was described as extraordinarily charming. He's polite, has perfect manners, is elegant, sophisticated, and he maintains an appreciation for civility and the arts, even when he's surrounded by terrible conditions. So he seems to meet this one. Number 3, prefers skilled work. Well, before he was caught, he was a psychiatrist. When he escaped custody, he took a job as a translator in a library. So some people have noted that Lecter is a good psychiatrist. I don't really think he is. Eating clients is usually frowned upon from an ethical perspective. He justified his murder of a client by saying that the therapy wasn't going well. It's a good thing that every mental health professional doesn't apply this standard. Apart from the ethics and the law, it would also be hard to build a practice with that reputation. Like in a review of a mental health professional, you might see pros and cons. Pros, good listener, sophisticated, provides online counseling. Cons, has murdered and eaten clients in the past. Most potential clients would think even one of those was bad enough, but both murder and eating just seems like a little much. Moving to number 4, sexual competence. He was seen with attractive women during his time in Baltimore, so he meets that one. Number 5, high birth order status. He was the firstborn son of a prominent Eastern European family. Number 6, father had stable work. His father was a count in Lithuania, and typically those types of positions are fairly stable, right? Somebody's not going to be a count today and not a count tomorrow. Number 7, inconsistent childhood discipline. I've seen an argument made that Lecter meets this criterion. During his childhood, he and his sister were captured by deserters who killed his parents and his sister and broke his arm. This isn't really inconsistent discipline because they were captors, not caregivers. I think in reality we just don't know because Harris never provided details about Lecter's early years. So I'd have to say this one is not met. Number 8, controlled mood during crime. This one's fairly clear. We see from the book Red Dragon where he attacked a nurse and his pulse never went above 85. Number 9, use of alcohol with crime. I've also seen an argument for this one saying that Lecter does use alcohol during the commission of a crime, but he's really not using it because he needs it to commit the crime. Rather, he's using it to enhance culinary choices, right? That's something different. That seems to be something that applies to Lecter and does not apply to many serial killers. Number 10, precipitating situational stress. This characteristic essentially says that the killer murders because of stress. I think that fits with Lecter because he has killed people just because he got tired or irritated with them. Number 11, living with a partner. Toward the end of the book Hannibal, we see that Lecter lives with Clarice Starling. Number 12, mobility with a car in good condition. Well, Lecter drove a Bentley and bought a Jaguar XJR, so I would say he had a nice car. Was it in good condition? I mean, in the past, Jaguars have been maintenance nightmares, and Bentleys aren't much better, so one could argue that it wasn't necessarily in good mechanical condition. If he had bought a Toyota or a Ford, I think it would have been better off in that regard. But that's a whole other story. So, yes, he had mobility, and his car was probably in reasonable condition. Number 13, follows crime and news media. I don't think that he meets this one because he has no interest in following his exploits in the media. He does have a fascination with natural disasters and atrocities, and he collects news clippings about those events, but that's not the same thing because he didn't cause those. So then we see number 14, the last characteristic of an organized type serial killer, may change jobs or leave town. Lecter does meet this one. He changed his occupation, as I mentioned before, and he changed cities from Baltimore to Florence. He's also done other things to hide his identity, which I think touches on this particular criterion, including administering silicone injections to change his appearance. So he meets 11 of the 14. Now here's where the problem comes in. When looking at a large number of serial killers, we realize that the organized-disorganized paradigm doesn't actually hold up. It's not a good way to divide serial killers into categories. If Harris developed Lecter from this paradigm, he only contributed to Lecter being unrealistic. Now moving to the issue of psychopathy. Is Lecter a psychopath or a sociopath? So before I get into this status for Lecter, I want to cover his 5-factor model because it really does inform that discussion. I remember the 5 factors through the acronym OCEAN: openness to experience, conscientiousness, extroversion, agreeableness, and neuroticism. So with openness to experience, Lecter would be extremely high on this particular trait. He's intellectually curious. He appreciates art. He is adventurous. So he is very open. On conscientiousness, he'd also be high. He is well organized, deliberate, productive. He's the kind of person that would be on time for an appointment. Moving to extroversion, here he's probably around the middle. He was comfortable being in high-status social circles in Baltimore, but at the same time, he has very good analytical skills. So I would put him in the middle here for extroversion. With agreeableness, he would be fairly low because of the murder part, but also just because of some of his interactions. He doesn't really appear to be altruistic and terribly trusting. Moving to neuroticism, he would be extremely low in neuroticism. He does get angry sometimes, but he is able to resist temptation for the most part, and he doesn't appear to be anxious or depressed. So with that in mind, let's look at psychopathy. To understand psychopathy, it's first important to understand that it is divided into 2 categories. The terms can be a little confusing the way they're used. We see primary or factor 1 psychopathy, typically just called psychopathy, and we also see secondary or factor 2 psychopathy, which is sometimes called sociopathy. I'll go through the different characteristics of each type, and let's see where there's an alignment or not an alignment with Hannibal Lecter. So with factor 1 psychopathy, the first item is superficial charm. I think Lecter is supposed to be authentic, so it's not really superficial, it's not on the surface. He is genuine in his personality, even if it's not necessarily a likable personality. Next item is grandiosity. He does think a lot of himself, but I don't think he really rises to the level of grandiose. Looking at pathological lying, he does lie to get away with crimes, but it's not really part of his personality. He just doesn't make things up because he feels like it. People with this characteristic tend to make up lies for no reason, for no benefit. Moving to manipulation, he definitely tricks people at times, but his strategies are not based on deception. It's really not about interpersonal manipulation. He's clever and crafty, but those are different than manipulation. Lack of remorse or guilt, this one he does seem to have. Shallow affect, he's not very expressive, but his affect isn't shallow. The emotions he expresses are real, even if they are subdued. This takes me to a lack of empathy, being callous. I think many people believe that Lecter does lack empathy, but I'm not actually sure that he does. He causes suffering, which is often attributed to a lack of empathy, but I think he does understand how people feel. He may not act on his empathy like most people would, but I think it is actually a key part of his character, the idea that he can read people. Again, he is a mental health professional. His criminal behavior isn't generated by a lack of insight on how other people feel. The last characteristic for factor 1 psychopathy is a failure to accept responsibility. With Lecter, we don't really see that. He doesn't want to pay the price for his behavior, but he does actually take responsibility much of the time. So in looking at factor 1, there's only one characteristic he has. I think an argument could be made for maybe 1 or 2 more, but overall, he's not a good fit with the construct of factor 1 psychopathy. Now looking at factor 2, Lecter's alignment with this type of psychopathy is really even easier, right? It's very clear with this factor. He does not have sensation seeking. He doesn't have a parasitic lifestyle, a lack of realistic long-term goals. He's not impulsive. He's not irresponsible. He does not have poor behavioral control. He may have been a juvenile delinquent. It talked about crimes he committed as a teenager. We do not see a revocation of conditional release, but we do see criminal versatility. So again, here we have 2 characteristics for factor 2. Lecter does not seem to have either type of psychopathy. He would not qualify for a diagnosis of antisocial personality disorder either. That one largely aligns with factor 2 psychopathy. Lecter's early years don't seem to line up with the MacDonald triad either, so That's tied in with somebody becoming a psychopath. The triad has 3 risk factors. Looking at these, we see Lecter did torture small animals, but there's no mention of setting fires or bedwetting. So with all this in mind, it would seem that Lecter is unrealistic from a mental health and personality perspective. It's hard to imagine a serial killer who does not have either type of psychopathy. Harris's writing seems to embrace the fact that Lecter does not fit into known mental health categories. In his books, it is discussed how mental health professionals are confused by Lecter. Some have said that this is simply pointing out his lack of experience in the world of mental health, meaning that Harris doesn't create a realistic character, and then essentially covers for that in his writing by saying Lecter doesn't fit into any category. I think this is possible, but I also believe that Harris could have written Lecter the way he did on purpose, a character that defies conventional understanding about the origins of these types of murders. So here the question becomes, is Lecter a human being? Maybe he was never supposed to be like a real killer. Maybe it doesn't matter that he's unrealistic. He could be something completely different. This is an interesting theory. When we look at Lecter, we see his character is so unrealistic that he could be a supervillain from comic books. A few examples: he may be one of the most intelligent people who has ever lived, if not the most intelligent person. He has understanding of many complex disciplines: medicine, mental health, cuisine. He's a musician, and he understands physics. He has a fantasy life that is so powerful he can create his own reality. He's described as a monster who has red eyes. He is a human lie detector. He can see in the dark. He has a good sense of smell. He can move silently. Size for size, he's physically as strong as an ant, which means that Lecter could lift 8,000 pounds if he weighed 160 pounds, because an ant can lift 50 times its weight. So that seems pretty phenomenal. Lecter is resistant to drugs. He does not respond to physical pain, and he has dominion over animals. So with all these incredible abilities, it would make more sense to think of Lecter as something like a vampire, the devil, or possessed, some other embodiment of evil. We know that Jeffrey Dahmer told police that he wondered if he was being influenced by an evil force. Other serial killers have made similar statements. So stepping back and looking at everything, is Lecter a psychopath? No. Is his character realistic? No. Is his character supernatural? Yes, but I don't think he was supposed to be that way necessarily. Which brings me to the conclusion that even though Hannibal Lecter is a very entertaining character, his character development is not consistent with that of other serial killers. He's an interesting supervillain, but not a congruent case study from a mental health perspective. Many people have criticized Thomas Harris for writing Lecter in the way that he did, but his books are fiction. They're supposed to be entertaining. He never said it was a manual that law enforcement should use to solve crime. So those are my thoughts on Hannibal Lecter. Please put any opinions and thoughts in the comment section. They always generate an interesting dialogue. As always, I hope you found my analysis of this topic to be interesting. Thanks for watching.